can start.
All right, I'm going to go and start letting people in now. I'll just sit quietly.
All right. Good morning, everyone. It looks like we've got quite a few people entered into the meeting, so we'll go ahead and get started. My name is Claire Sparra. I am the Legislative Director for the Indiana Department of Insurance. So thank you on behalf of the department and SHIP for joining this webinar this morning to discuss Senate Enrolled Act 215 from this past legislative session. And our SHIP team is really excited to talk about this bill and what this is going to mean for Indiana and for Hoosiers. But we wanted to take a quick moment this morning to recognize the legislators who authored and sponsored this bill and made this legislation happen. So Senator Kyle Walker was the bill author for Senate Enrolled Act 215, and Representative David Abbott was a bill sponsor. So thank you both for your hard work on this bill and in the Medicare supplement space this last year and every other year. Unfortunately, Senator Walker had a conflict today, so he's not able to join. But before I turn this over to Ben, who is going to do the presentation, I wanted to give Representative Abbott a chance to say a few words on the bill or the process in getting Senate Enrolled Act through session if he wishes. So I'll turn the floor over to him, and then I'll let Ben take this over.
Thank you so much for having me on today. I appreciate that, and excited to hear what the participants have to say about the legislation and how that's impacting the industry. Yeah, it was a process that was brought to me by Randy Head just over a year ago. We talked about the need to widen the Medigap coverage for under 65, especially for the end-stage renal disease folks. And we worked through that over the summer and the fall. We came up with some legislation. Senator Walker carried that in the Senate. And of course, I sponsored, and Martin Carball also sponsored this bill in the House. Martin's got extensive experience in the insurance industry as he is an insurance agent. So he was a very good fit for helping carry that through the House. So we both worked on that together. Martin did a huge amount, I have to say, added to the conversation, because he pointed out a lot of the points where we needed to work and massage this bill to get it to where the insurance industry was okay with it. And we were also achieving what we were trying to achieve is to help out the under 65 who, in a lot of cases, we met and talked with people that were spending down with premiums 4 or 5 times higher. Not just disability, under 65 for disabilities, but the end-stage renal or ALS, those were causing some of these folks that had, limited income. They had a nest egg buildup, but they had to spend down those assets. The premiums were too high to sustain. And they were really just pretty much using up their retirement money to get onto Medicaid, which in turn, over the long term creates a burden for our Medicaid or our Medicare program too. And that was, especially the Medicaid, I should maybe emphasize that more, because that's a cost that is kind of a hidden cost that's also being incurred when folks had to had to spend down their incomes to get onto Medicaid. Whereas if the rates would have been comparable with over 65, and we felt that the risk pool and the cost spread out through the work we did with insurance industry, we came to, I think, an equitable compromise that I think we accomplished what we wanted in the most part. And I'm happy to see that. I'm glad it passed. I'm really interested to hear the thoughts on everyone and how this is going to work out. I know we're about to implement that soon with some of the provisions. So I'll be anxious just to sit here, listen, and take it all in. We're going to be also working on a bill this year for, I'm kind of giving a preview, possibly to look at end-stage renal disease folks that are receiving a living donor transplant, which would mean you have a healthy individual that has 2 good kidneys, donates one of them, but then in some cases they are being penalized on premiums for having a higher risk with 1 kidney left rather than 2. There's a lot of professionals have said that this is probably an unfair assessment, that they're being penalized with higher premiums or even denied coverage or other restrictions that might be applied to them just because of the fact they donated a kidney. And we're going to be discussing that and seeing what can be done, if anything. And stay tuned for that. I'm not sure who's going to carry that bill yet. I know my name's come up, so we'll wait and see on that one. But thank you for having me on. I just want to sit back and listen to you guys.
All right, wonderful. Thank you, Senator Abbott. Thank you, Kyle Walker, as well, and all those involved. This is a tremendous opportunity for the state of Indiana and for our under 65 beneficiaries. My name is Ben Hudson. I am the training director for the Indiana State Health Insurance Assistance Program, better known as the Indiana SHIP program. We are a division of the Indiana Department of Insurance, and I'm here today to talk about SCA 215, Medicare supplements for those individuals under the age of 65 years old. We are currently recording today's session, and this session will be posted online to both the Department of Insurance's website as well as our Indiana State SHIP website as well, and spread across the state. One thing we'll discuss today is it is really up to us to spread the word as insurance agents, affiliates with the state of Indiana, financial planners, as this really has the ability to benefit our clients under the age of 65 and provide them an opportunity for health insurance and Medicare that really hasn't been accessible to them in years past. At the end of today's presentation, you will see my contact information, both my direct phone number and my email. You are more than welcome to share that with anyone, and I'd be happy to receive any questions we have on this discussion today. A little bit about the SHIP program real quick and what we do and what we can provide to your clients. So we are a division of the Indiana Department of Insurance, despite the fact we are federally funded through the Administration on Community Living. There is a SHIP program in all 50 states across the U.S., as well as our U.S. territories, and we are all entrusted with the same regulations, which is to provide unbiased Medicare education, counseling, advocacy to our U.S. Medicare beneficiaries. Here in Indiana, we have about 400 certified Medicare counselors that go through about a 3 to 4 day certification process, learning all about Medicare with the intention then that we can meet locally with beneficiaries here in the state to provide that advocacy, counseling, and instruction in regards to the Medicare program, ranging everywhere from how do I sign up for Medicare, when do I sign up for Medicare, and then taking it a step further once we're on Medicare, filing complaints, grievances, appeals, claims histories, and billing issues with our clients. We can really handle everything Medicare A to Z. We do not have any affiliation with any insurance companies here in the state of Indiana. What that allows us to do, hopefully, is to provide the most unbiased Medicare information we possibly can to our clients. Our key goals for today is to explain this new bill that was passed this year, SCA 215, which is allowing Medicare supplement plans to individuals under the age of 65 in a way that it's never been offered before. We're also going to learn that Medicare supplement plans can really provide some valuable cost-sharing protection, allowing an additional insurance to cover your client's leftover medical bills. Something, again, historically, Medicare beneficiaries over the age of 65 years old have had opportunities for guaranteed enrollment, meaning they will be guaranteed to be sold those plans and afforded those particular protections. At the end of today's presentation, we also have some additional resources, including our information, Medicare's information, and some other trusted resources online. We'll start off today talking a little bit about Medicare, just to get all of us on the exact same page in regards to what Medicare is, who Medicare is for, and more importantly, what are my options when I am on Medicare. That'll lead us nicely into a history of Medigaps in Indiana, where we can talk about where we have been, what the federal stance is on Medigap plans for under 65 years old, and then more importantly, that will bring us into the new regulations starting in 2025. So a big question we always start with is, what is Medicare? You know, at this stage in the game, most individuals can accurately state that Medicare is some fashion of national health insurance available to some groups of people effectively. Now, Medicare is in fact that national health insurance program with a large statistic population of individuals who are 65 years or older. A subpopulation, a smaller group of individuals who are also entitled to Medicare would be individuals under the age of 65 years old, but to get that Medicare eligibility, they have to be on Social Security disability for 24 consecutive months. Now, there is a third group of individuals on the next slide as well, and those are individuals at any age in their lifetime diagnosed with end-stage renal disease. This is another particular group that has a heavy population under 65 years old, where this new SCA 215 bill can actually benefit them. So we are primarily going to focus today at that under 65 group, but just know that statistically speaking, they are a smaller demographic, but they are an extremely important demographic who tends to have higher health concerns, higher healthcare costs. And again, this is why this is so necessary for them to have this extra insurance. Just to review, those three groups of people who are eligible for Medicare is anyone over the age of 65, anyone under 65 years old on Social Security disability for 2 consecutive years, and someone at any age in their lifetime diagnosed with end-stage renal disease or kidney failure. As far as my eligibility is concerned, I just need to be a U.S. citizen or lawfully present in the United States, such as a green card holder, for a minimum of 5 years. As long as I am a U.S. citizen or a legal resident, and I meet one of these 3 other criteria, like being 65 or older, I'm immediately entitled to my Medicare benefits. How much I paid in taxes, how much I have worked, doesn't necessarily have anything to do with my sheer eligibility for Medicare, but that does come into play when I talk about the cost of Medicare. So how many years you have worked and paid into your Medicare and Social Security taxes could ultimately have effect on what your Medicare premiums could be in the future. But your sheer eligibility, again, is just based on that U.S. citizenship and these 3 criteria. 5 big discussion points within Medicare we see up on the screen right now. On the left-hand side, we'll start talking about what the federal government tends to provide through the Medicare program. Medicare Part A is that first part of Medicare, what we dub the hospital insurance. Medicare Part A is that portion of insurance that would cover me as an inpatient in a hospital or a skilled nursing facility. So as a true inpatient, not just in the emergency room, not an observation status, but actually admitted to the hospital. Medicare Part B is just the opposite. This is all your outpatient related services. And for the most part, this tends to be the portion of Medicare that's more highly utilized for our clients, as these are the things that most of us would have rendered on any given year. Things like your normal preventative services, your doctor's appointments or checkups, durable medical equipment, urgent care, emergency rooms, all those things we may need on any given year. One of the first confusing things about Medicare is the fact that the government does split up those 2 types of services. Most individuals with employer-based health insurance or Medicaid-based health insurance just simply know that they have health insurance. They go to the hospital, they go to the doctor, and health insurance could cover that bill for them to some extent. Medicare breaks these 2 parts of Medicare into 2 sections, the inpatient and the outpatient. So if I didn't have the Medicare Part B, I simply don't have outpatient coverage. So for most of us to continue to feel fully insured on Medicare, we would want to make sure we are enrolled into both Part A and Part B. Right below that, under the word optional, you'll see that word Medigap. Medigap is a synonym for Medicare Supplement plans. They really mean the same thing, and you'll probably hear me interchange that term throughout today's presentation. Medigap plans, in a nutshell, are private insurance sold by private insurance companies approved by the Indiana Department of Insurance to sell in this state. And that additional insurance can help provide some cost-sharing relief after the government's Medicare. So for example, if the government's Medicare pays 80% of my bill, I'm normally left with 20% of that bill. That Medigap plan could step in and cover that 20% for me. On the right-hand side, under private insurance, one of the new tools or new ways to receive your Medicare benefits in the last couple decades are in the form of Part C, also known as Medicare Advantage plans. Medicare Advantage plans are simply an alternative way to receive your Medicare benefits. Number one, you are still on the Medicare program. You still enrolled into Medicare in the same avenues that anybody else enrolled into Medicare. But once you joined Medicare, you have the option to change where your Medicare is actually being administered from. So the government, the federal government, actually approves private insurance companies to provide your Medicare Part A and B benefits directly to you, and they are partially funded by the federal government through the Medicare program. In addition to providing those Part A and B services from private companies, they may also include your Part D drug insurance built right into that plan, as well as some additional goodies that consumers have come to love, like gym memberships and over-the-counter stipends. You heard me mention Part D just now briefly. Part D is the simple one. That stands for drugs. So Part D is just simply Medicare governmental approved prescription drug insurance. For the most part, working the same as the drug insurance that you or I may have from our employers. One of the most important slides is this next one in regards to teaching someone who's new to Medicare, what are my options on Medicare? You'll notice that there are two main options listed as option 1 in the middle column and option 2 on the right-hand side. When you talk to a Medicare counselor, you talk to your trusted insurance agent, you talk to 1-800-MEDICARE, you are more than likely being presented with two main options, two main pathways as to where you can receive your Medicare benefits. Before we get to those two options, I want to talk about this left-hand column titled Minimum Coverage Once You're Eligible. As the name alludes to, once you become entitled or eligible for Medicare based on turning 65, 2 years on disability, or end-stage renal disease diagnosis, these are those minimum parts of Medicare that I must have to simply avoid Medicare penalties. That's why we talk about this minimum coverage, just simply to avoid those penalties. That minimum coverage says that I'm going to be enrolled into my Medicare Part A and my Part B. And since 2006, I also now have to have Part D or some other creditable coverage. Creditable coverage just simply meaning drug coverage that is equal or better to a standardized Medicare Part D plan. As long as I have that A, B, and D, I've done everything I need to do at a minimum to at least avoid Medicare penalties. But why we don't talk about this as really a viable option really has to do with finances. Despite the fact Medicare Part A and B does make you fully insured and does provide valuable coverage to you, really equivalent to most health insurance, what is abnormal about original Medicare directly from the government is there is no maximum out of pocket for your share of leftover medical bills. So if I go to the doctor and Medicare pays 80% of that service and I'm left with 20%, one may say that that's pretty normal as far as insurance is concerned, but what is abnormal is that 20% has no limit to it. So if I was to accumulate $100,000 worth of Part B bills, Medicare may pay $80,000, I could be on the hook for $20,000. Where typical insurance may cap your share of the bills at closer to $5,000, $6,000, or $7,000 for the year. So having original Medicare, the A, the B, and the D satisfies that minimum requirement to avoid penalties, but leaves you on the hook for theoretically unlimited leftover bills. Little foreshadowing, that's where those Medicare supplement plans can be so valuable to Medicare beneficiaries, both over 65 and under 65. They have the potential to cover those theoretically unlimited leftover bills. Before we move on to option one, though, I do want to clarify in the fine print at the bottom, and there's exceptions to really all Medicare rules, it seems, these days. The one way that I can actually delay my Medicare past when I become eligible for it is if I have insurance from my job or my spouse's job, because one of us is actively working to receive that health insurance. Another caveat to that is not only do I have health insurance from my job, but it has to be from an appropriately sized company. So if I'm eligible for Medicare because I'm 65, my company or my spouse's company where my insurance is coming from has to be from a company more than 20 employees. If you're under 65 years old and that's how you're becoming eligible for Medicare, your employer or likely your spouse's employer will need to be more than 100 employees for it to count. As long as you have that insurance due to you actively working from that appropriately sized employer, you have all the rights in the world to continue postponing your Medicare until that is not true. Once you retire or otherwise lose that insurance, you will then receive a special enrollment period to sign up for Medicare penalty-free. No other insurances, Medicaid, VA, marketplace plans give you that opportunity to delay your Medicare past when you're first eligible. Only that active employer insurance could do that. I want to move into option one now real quick. Option one, as you can see, is simply the minimum coverage, the A, the B, and the D. But as an option, and a highly recommended option, is making sure that you have some fashion of secondary health insurance. Statistically, for many of us, that's going to be in the form of these Medicare supplement plans or Medigaps. Or maybe I have access to Medicaid based on my limited income, possibly retiree insurance from my former employer. The goal is to really have someone paying after the government's Medicare, all in an effort to make it financially safe and protect you from those unlimited leftover bills. Again, for many of us, though, without access to Medicaid, without retiree health insurance available, Medicare supplement plans tend to be the best option for us. Option two now, as we mentioned earlier, are the Medicare Advantage plans. Simply speaking, this is just an alternative way to receive your Medicare. This is an either-or situation. Either you get your Medicare from the government directly in option one, or once you're on Medicare, you can elect to have your Medicare come from a Medicare Advantage plan in option two. A private insurance company that has been approved by Medicare on the federal level can then administer your Part A and B benefits to you, as well as bundling in a bunch of extra goodies as well. All right, moving on to our next section, talking about Medigap plans. A couple things to know about these Medicare supplement plans, because that is our focus today. So these, number one, are optional. They are not required for Medicare beneficiaries, but again, they're just highly recommended, specifically if you're on original Medicare. These Medigap plans are sold by private insurance companies that have been approved by the Indiana Department of Insurance or approved by the Department of Insurance in whatever state you reside in. And those companies are allowed to sell a fashion of standardized Medigap plans, which we'll learn about what that means in just a moment. An additional thing to note about Medigap plans is they only work with original Medicare from the government. They are created and intended to supplement the government's Medicare. You are actually not allowed to have a Medicare supplement plan paying after your Medicare Advantage plan in option two. On slide 11, another thing to note about the Medigap plans is they are standardized by letters. Just like Medicare has the Part A, B, C, and D, Medigap plans also run A through Plan N. Now, there's a handful of plans missing from that list over the years, okay, but we are still left with a decent amount of Medicare standardized plans. There are 47 states across the U.S. that actually standardize their Medigap plans in the exact same way that the state of Indiana does. And what it means to be standardized is each letter offers a certain number of benefits. So a Plan G, for the most part, on a basic level is the same, whether it's from Humana, Mutual of Omaha, Physicians Mutual, State Farm, etc. Whomever sells that plan, Plan G is Plan G regardless of where you get it from. And on the next slide, we can take a peek at what some of those plans could look like for you. As I mentioned earlier, Medigap plans do not work with people on Medicare Advantage. They are specifically a product for individuals on original Medicare from the government. One of the basic requirements is you do in fact have to be enrolled into both Medicare Part A and B to even enroll into a Medigap policy. This is with the intention of getting them to function the way that they're supposed to function. You may pay an additional monthly premium to your private insurance company. This is in addition to your Medicare Part B premium on a monthly basis. One of the big perks of being on original Medicare and also having one of these Medigap plans is original Medicare has a network that spans the entire United States. As long as I go to a provider that accepts Medicare, I can go there. So by being on original Medicare, it allows the flexibility of Medicare beneficiaries to seek care at the providers that they would like to go to, maybe regardless of hospital chain, and more importantly, regardless of geographical territories. So a nice option possibly for those who travel, those who have doctors in lots of different areas of the country, our snowbirds, of course, giving us the option to have a doctor in Indiana, just like I have a doctor in Florida, for example. And that Medicare and that Medigap plan will function the same way as long as I'm at those Medicare providers. Now, ultimately, as far as cost is concerned, even when you are guaranteed to be sold one of these Medigap plans, insurance companies are still allowed to judge or rate your premium based on things like your age, your gender, your zip code, and your tobacco use. Outside of these set or designated guaranteed enrollment times, these companies can also run you through medical underwriting. The ability to look at your past health or your pre-existing conditions is a way to determine if they want to sell you the plan or as a way to determine what your premium rate will be. On the next slide, I'll just pause here briefly. This is the standardization of our supplement plans. And again, 47 states across the US actually standardize their plans in this exact same way. So Plan G here in Indiana is the same as in Ohio, for example. You can see that Plan F is really kind of the most comprehensive plan available. Plan F is still available, but based on some 2020 government regulations, Plan F is only available to those that were newly eligible for Medicare before January 1st of 2020. As long as I was eligible for Medicare before that date, I could sign up for the Plan F. But right now, statistically, for most of our beneficiaries turning 65, that Plan G is looking like the better option for them, more importantly, because that's the best one available to them as far as most covered benefits. All right, thanks for allowing me to go through a little overview of Medicare benefits just to get us all up to the same level and on the same page. But we want to dig in now to Medigaps for under 65-year-olds and why we're here today. So to start us off, I want to talk about Medicare's federal stance on supplement plans for under 65-year-olds. As it currently stands, the federal government does not have a requirement for insurance companies to provide guaranteed enrollment into Medicare supplement plans if you're on Medicare under the age of 65 years old. Certain states across the US have passed their own laws to require this guaranteed enrollment, and this is something that Indiana has been able to successfully do this year, starting next year as well. Before we get to that, though, a little history of where we've come from here in Indiana specifically. For individuals under the age of 65 who really don't qualify for any additional insurance like Medicaid that could pay after Medicare or retiree health insurance or something like that, Medicare Advantage plans have statistically been the best way for them to receive their Medicare benefits, really just due to that financial protection. The federal government's original Medicare does not have that maximum out of pocket for your share of the bills, but they do require a max out of pocket when you're on a Medicare Advantage plan, upwards of almost $9,000 in a year this year. Here in Indiana, our average is closer to about $5,100 at most out of pocket when joining a Medicare Advantage plan. Still thousands of dollars when your client has a bad medical year, lots of procedures, lots of surgeries, but $5,000 is at least better than having no cap when you were on original Medicare. Back prior to 2019, there was a law passed in Indiana that was dubbed Tammy's Law. Tammy's Law was an attempt to bring guaranteed issue and coverage for supplement plans to people under the age of 65. This bill ultimately did pass in Indiana and went into effect in July of 2019. And that is actually what we still currently have today. There were two issues, unfortunately, that arose later on with Tammy's Law. Number one, this did not provide guaranteed enrollment into Plan A when you were under 65 years old. The way that law actually read is, any insurance company that sells plans to people over the age of 65 years old must also make Plan A available to people under 65. So that was the wording. It only had to be made available to them. So we had a lot of insurance companies, of course, who you were instructed to offer this Plan A. But in that first issue we see at the bottom, there was no governmental requirement for them to actually sell that plan to you without medical underwriting and with a guarantee. So individuals would apply for the plan and likely be denied based on their pre-existing conditions. Remember, under 65 years old, the only way I'm qualifying for Medicare is having Social Security disability or having end-stage renal disease. Two issues that may provide a lot of additional costs for insurers to insure, additional medical bills, for example. So there just wasn't a good fit in regards to us being able to insure you. The second problem was there's no limitations on that Plan A's monthly premium. We started seeing Medicare or Medigap Plan A's that were anywhere from $250 to $700 per month when you're under 65 years old. To put that in perspective, at 65 years old, that same Plan A would cost you closer to about $100 per month. So even if someone was able to find a company willing to sell them that Plan A, it still may not have been cost effective for them paying $500 a month, when in reality, they could just join that Medicare Advantage plan and be capped at some level for their leftover medical bills. It just didn't make sense for them to have this Plan A. If I jump back a couple slides to our little chart about supplement plans, you'll notice Plan A is actually the least comprehensive of all the plans to begin with. So all they even had access to was that supplement Plan A, the least comprehensive of them all, but they weren't guaranteed. And even if someone was able to get a plan, the price could still be excessively presented to them. On our next slide, here's our good news for today. I'm extraordinarily excited to talk about this and talk about the fact that SEA 215 was introduced and passed in the spring here in Indiana. What this ultimately means is starting January 1st of 2025, there will be guaranteed issue into Medigap plans for people under 65 years old. And more importantly, guaranteed issue into all available Medigap plans that insurance company may sell, not just Medigap Plan A. So effectively what this will look like is January 1st through June 30th, the first 6 months of 2025, any Medicare beneficiary under the age of 65 years old, currently on Medicare right now, will have those first 6 months of 2025 to be guaranteed enrollment into any Medigap plan from any company that sells the plan that they want. That could include that Plan G, that could include a valuable Plan N, and maybe even all the other plans out there, such as that little Plan A as well. But most importantly is that guaranteed issue period. 6 months when I can call these insurance companies, meet with my trusted insurance agent, and I will only be subject to paying premiums based on things like age, gender, zip code, tobacco use, etc., and no longer my pre-existing conditions. If you have clients who are meeting their 2-year mark on disability sometime after the first of next year, or they're diagnosed with end-stage renal disease after the first of next year, they will be granted their own 6-month guaranteed issue period where they can sign up for a Medigap plan guarantee. Now, by all means, this is not a requirement for our clients under 65 years old to go with a Medicare supplement plan. This is just simply now a viable option that they've never had access to before. And for those of our clients who have excessive medical costs and bills, wouldn't it be nice if we could have some extra insurance to cover those bills for us, just like someone 65 years or older? So the big takeaway today, and one of the things that we'll want to talk about with our clients over the next year, is those first 6 months of 2025, if I'm under 65 years old and on Medicare, I have an opportunity with guaranteed enrollment to purchase a Medigap plan here in the state of Indiana. At the bottom of the slide, a couple prohibitions for these insurance companies that are offering these Medigap plans. That second bullet point says the issuer shall not charge a premium rate for plans A, B, or D that exceeds the premium rate an issuer charges to someone 65 or older for the same policy. That means that not only am I guaranteed to purchase plans A, B, and D, no medical underwriting, I'm actually going to pay the exact same price that a 65-year-old would pay for my same gender, zip code, and tobacco use. So there is a prohibition or a limitation on the prices that could be charged for those three particular plans. Again, if you allow me to jump back to our chart, plans A and B, again, are some of the least comprehensive plans available, but plan D is kind of a standout option here in regards to looking like some of the better plans that we have access to, like the plan G. You'll notice that plan D as in dog really covers all of your leftover medical bills, including copays and coinsurances, initial deductibles for Part A, and the only thing you're really left with after Medicare pays would be a Part B deductible, right at $240 per year this year, and then something called Part B excess charges, which isn't something that's statistically that prevalent, relatively speaking. It's just an extra amount of money that you may owe at certain providers. So Plan D may ultimately become the standout plan for those clientele under 65 years old. The next bullet point says that for any other supplement plan out there, the insurance companies are not allowed to charge a premium rate that exceeds 200% of the premium that they would charge a 65-year-old. So that means every other supplement plan that is sold by that insurance company, such as the Plan G, cannot exceed 200% of what they charge a 65-year-old. So based on the wording of this law, that 200% of the premium is referencing essentially double the price. And not triple, but double the price. Even at double the price, possibly $300 per month for a Plan G or more, that could still financially be a valuable option for clients. At $300 per month times 12 months in the year, you're at $3,600 in premiums out of pocket. You throw in that Part B deductible that the Plan G does not cover, so another $240 for the year. You are still a few $100 shy of $4,000 in out-of-pocket expenses to be on the Medigap plan. That $4,000, or roughly $3,850 we're calculating, could still be far cheaper than maxing out your out-of-pocket limit on your Medicare Advantage plan. Maybe that's $5,000, $6,000, or $7,000. So not only am I possibly saving money in my out-of-pocket leftover medical bills, I am now on original Medicare again, which allows me that opportunity and flexibility to traverse the U.S. and seek care at those providers all across the U.S. that accept Medicare. So those are the big takeaways for today. You are guaranteed enrollment under 65 years old starting the first 6 months of 2025. If you are newly eligible for Medicare under 65 after January 1st of next year, you will be granted your own 6-month window of guaranteed enrollment. It is important to share with our clients, though, that after that 6 months, so after June 30th, or after your client's specific 6-month window, they will no longer have that guaranteed enrollment. They will have the ability to sign up for plans at companies who are willing to sell them plans under 65 years old, but they will no longer have that guaranteed enrollment, which means they would have to go through medical underwriting in most cases. Those clients under 65 years old, if they miss this 6-month window, will not actually have another opportunity for guaranteed enrollment until they turn 65 years old, assuming they still have Medicare at that time. All right, so this is very important. We spread the word and share that this is a 6-month window of guaranteed enrollment. So ultimately, knowing that this is something that is an Indiana-specific law, this is something that we have established and we're able to pass in the state of Indiana to benefit our beneficiaries in the state, it is really up to Indiana and the Department of Insurance and anyone who works with this particular demographic of clientele to spread the word. We're likely not going to have statewide advertising, commercials, newspaper ads, or anything like that. This will simply be word of mouth. So when you're meeting with clients under 65 years old, who have that Medicare eligibility, not only can we continue talking about viability for them to be on a Medicare Advantage plan, we can now add in this additional option, something again that historically has only been available to people over the age of 65 years old. Our job as SHIP counselors here in the state of Indiana, of course, is to provide factual information, both the pros and the cons of both of those available options. We're not here to pressure them into one option versus the other, but this ultimately may make sense financially depending on the specific client's health conditions and their financial situations. For those of you looking for additional information, these are clickable links in this recording. You can always reach out to us on our Indiana SHIP webpage. For those of you who are Medicare beneficiaries already, you should receive a Medicare and You handbook in the mail. The 2025 handbooks have already been sent, and you likely already have that in your possession. And then a trusted nonprofit organization that provides Medicare information through the Medicare Rights Center, a national organization, is called Medicare Interactive. Nice online tool. My contact information is at the end of today's presentation. You are more than welcome to reach out to me directly by phone or email, and I'd be happy to answer any questions. To wrap up today, I just want to extend a special thank you to Senator Abbott for joining us today, Senator Kyle Walker for heading this bill. This is a tremendous opportunity for our clientele under the age of 65 years old, has the potential to save thousands of dollars potentially out of pocket for these clients, and ultimately allow them access to care that others on Medicare have access to. So on behalf of the Indiana SHIP program and the Indiana Department of Insurance, I do want to thank you for joining us today, and we look forward to spreading the word about SCA 215.